So that's interesting. It's the compulsion that really sort of separates out the disorder.
Yeah.
Is it very much similar then to anxiety in terms of presentation outside of that? That's sort of the defining characteristic, or how do those things relate?
Sure.
Like there's a lot of chicken and the egg in mental health of like
Sure.
ADHD and depression, right? Are you sad because you can't focus, or can you not focus because you're struggling?
Long answer, it depends, right?
Yep.
So if we talk about if we look at depression, for example, it would be rare for somebody to not have some level of mood impairment when they have OCD.
Right.
Especially if we're talking about people that come to us for like an IOP level of care where they're doing 8, 12, 20 hours of compulsive behavior a day. How could you not be depressed? And so a lot of times what happens is we start treating that OCD and that mood will just improve on its own. So that kind of is what comes to mind if we talk about the depression piece. For how just kind of obsessions and compulsions operate, I tell people with OCD, and I don't mean this to be not insensitive, but we have to change how you think about OCD. You don't necessarily have an anxiety problem, you have a compulsion problem. Okay. The other thing that's different, and I won't say this, as an absolute rule, but one thing that's mainly unique with OCD is the different emotions that are present in addition to anxiety. So that would be a major difference as well. So when people have fears, most likely they're experiencing an element of anxiety. But what's not talked about is the crippling fear, disgust, shame, guilt, panic. Those are kind of the main ones that come to mind as a response from that obsession that then creates this desire, this sense of urgency to do a compulsion.